Cervical cancer is caused by long-term human papillomavirus infection. According to World Health Organization, high-risk HPV 16 and 18 cause 70% of cervical cancers and precancerous cervical lesions. Most female want to know, what's the cervical cancer risk and survival rate by age range? Am I too young to get cervical cancer? Let's start by SEER Cancer Statistics published by the United States National Cancer Institute. With the reported cervical cancer incidence started at the age group of 20 to 24. Statistics show cervical cancer tends to occur in midlife, most frequently diagnosed in women between 35 and 49 of age. According to the American Cancer Society, in United States the Hispanic women are most likely to get cervical cancer, followed by African Americans, Asians, and Pacific Islanders, and whites. In another study that covered 92% of the U.S. population, for cervical cancer cases in women aged 40 years or below, the research shows 78% were diagnosed in women aged 30 to 39, 21% were diagnosed in women aged 20 to 29, and 1% was diagnosed in women younger than age 20 years. For cervical cancer cases and incident rate in United Kingdom, the highest incidence rates being in the 25 to 29 age group. Age-specific incidence rates rise sharply from around age 15 to 19, and peak in the 25 to 29 age group, then drop gradually until age 60 to 64 before rising again. According to Cancer Research UK, cervical cancer, just like other cancer types with a screening program, the incidence increases rapidly at the age screening starts, as prevalent cases are identified. Incidence then tends to return to the usual pattern of gradual increase with age, which largely reflects cell DNA damage accumulating over time. Research show younger patients have better chances of successful treatment, and the age of patient when cervical cancer is diagnosed has significant impact on the likely prognosis. Among the celebrities diagnosed with cervical cancer, Marissa Jarrett Winokur won her battle against the disease. The Tony Award winner learned that she had cervical cancer at the age of 27. She underwent hysterectomy with intensive follow-ups, and was declared cancer-free 8 months after her surgery. However, cervical cancer can still be dangerous even for younger women. One unfortunate case is the Big Brother star Jade Goody, who died of cervical cancer when she was only 27. Another incident is singer and songwriter Jessie Zazu, who passed away at the age of 28 after an 18-month battle with cervical cancer. The cervical cancer survival rate depends on many factors besides the patient's age. It is a treatable disease if detected early. For early cervical cancer stage 0 and stage 1A, statistics show the 5-year survival rate is about 91% to 93%. However, the survival rate drops to below 10% if cervical cancer is diagnosed late at stage 4, when the cancer has already spread to other distant organs. Cancer survival rate also varies by countries and racial differences. According to World Cancer Research Fund, highest cervical cancer incidence was in Africa and Latin America, whilst the lowest incidence in Northern America and Oceania. Study also revealed 5-year cervical cancer survival rates for white women are 69% versus 56% for black women. And as with most cancers, patients' cervical cancer survival rate and long-term outcomes have improved over the years. This is thanks to the development of new cancer treatments and therapies that are more effective. So it is very important to go for cervical cancer screening, so that treatment can start if abnormal cervical cell change is detected. HPV vaccines can also help to protect against high-risk HPV types that may cause cervical cancer. According to American Cancer Society and NHS UK, the risk factors of cervical cancer include high-risk HPV infection, smoking, weakened body immune system, and long-term use of oral contraceptives or birth control pills. Are you too late to take HPV vaccination? What are the 8 alarming cervical cancer symptoms? Watch the videos below to learn more.